October 21st, 10 days, we're done October. If you don't know, I have a thing about numbers and dates and all that, but you know that if you've been with me a while, you know that. Thank you for being here. My channel is The Anxious Woman, that's me. I'm just now settling my nerves. I had a dentist appointment today, and to be completely transparent, I have not been to the dentist since December of 2022. That's not like me. That's very unusual for me. I am a every 6 month, no matter what kind of dentist girl, even though I do not like going to the dentist at all, like most of us. And I didn't get to the dentist in 2023 because of my late partner being so ill. And then in 2024, I had an appointment, and between my late partner dying and all of the paperwork and things I was going through, the being overwhelmed, I canceled an appointment that I had. In January, I called my dentist office and I made my appointment. They couldn't give me an appointment until today. So when I made the appointment, it was 10 months away. Like 10 full months. They were short a couple of hygienists, and I was put on a call list, and they just did not have any openings, but I went today. And I can tell you I was that close to canceling. By noontime, I had so much pressure in my chest. I felt like I was just going to pass out. I couldn't breathe well. My chest hurt. My chest still hurts. My spine hurts from being so tense. My husband went with me. He drove us up there. He waited in the waiting room. I had a 2 o'clock appointment. I got done at 3:15. My insurance covered what was done. So I had 18 x-rays. I had the bite wings, but then I had like the full mouth up the roots, and to see if there was any infection or anything. So they do that every 5 years. And so that took 17 minutes, because I looked at my watch when she got done, all the x-rays. So it was 17 minutes of x-rays. And then my cleaning. And then my dentist came in. And I'll say, because I tend to build up plaque quickly, I'm thinking before I went there, I was thinking like, oh my God, she's going to say you have gum disease. She's going to say you have cavities. She's going to say you need to get this done, this done, this done. But my home care, I'm a fanatic with my home care. I floss every day. I clean through. I have a bridge here. I clean through that every day. Like there's no ifs, ands, or buts. I have 3 different kinds of toothpaste that I use. I showed that to you. It's stuff I got on TikTok. I have one for my gums, one for cavity reduction, and then one just for whitening. So when my dentist came in, and my hygienist, I had a different hygienist. The girl that did my x-rays, she could not have been sweeter. My new hygienist, because I had a hygienist for years, and she retired apparently, which I'm glad to hear. You know, I'm going to miss her, but you know, she was at that point and she retired. So I had a new hygienist. She's the girl I'll have each cleaning. They said that, you know, they want to keep you with a hygienist so that they know your history and they get to know who you are and where the good and bad spots are and whatever. Anyway, she could not have been more perfect. I was like, I told her like right off the bat, I'm just letting you know I'm on disability for, I have the sun coming in here. I'm on disability for severe anxiety and panic attacks. So I'm just like letting you know, a heads up. And the first thing she said to me was, what can I do for you if you start to feel anxious? How can I help you? And that sealed the deal for me, because no one has ever said that to me before, like in a professional setting like that. And I thought that was just amazing. What can I do for you? Anyway, she cleaned my teeth, polished my teeth. My dentist came in. She checked everything out. And I have no cavities. I have no gum disease. Nothing. Zero. She said, I'll see you in 6 months. She said, your home care is like immaculate. Keep doing what you're doing. So my hygienist suggested Sensodyne toothpaste. So I might go that route, but I'm not sure. The last time I used Sensodyne, my teeth actually hurt a little bit. I like the toothpaste that I'm using now, honestly. And my hygienist said, when I come back in 6 months, there's not going to be as much cleaning needing to be done. I told them, that I have osteoporosis. I told them about my vitamin D level being seriously low. The hygienist said that some of her clients use the ACT rinse. So I'm going to get some ACT and anything else that I can find that I think might help me. But anyway, I am so proud of me, because I was going to cancel like 6 minutes. Okay, I'm trying to keep my videos at like a decent time frame. I was going to cancel. I was this close to canceling, but I didn't. And just to have the support of my husband when I came out of the room, and my insurance covered, as far as I know, I didn't pay anything. My insurance covered the all that, and then I have $2,250 that if I would have needed cavities filled or whatever, I could have, I could use that. So I go back again in April. That's that. Now, second thing, my vitamin D, and I'm not sure how much of this I mentioned in other videos. My PCP had me do a blood test to check my zinc, my vitamin D. I was tested for syphilis, which came back fine. I don't have syphilis. I didn't think I did, but anyway, it's just the last part of the STD panel that she did, like a broad spectrum. Zinc, my zinc test just came back yesterday, and that's within range. So, but my vitamin D is dangerously low. Like 40 is low, 12 is severely low, and my vitamin D is 9, which is severely, severely low. I'm not out in the sun much. My body obviously doesn't absorb vitamin D. So I showed you in a prior video the mini calcium 1200 milligram with vitamin D3 in it. And there's 25 micrograms or 1,000 IUs, 125% of vitamin D3 in this. It says to take 4 a day with a meal. Now, my stomach bothers me a lot when I take vitamins. Like, my stomach starts to hurt. So I'm taking 1, not 4. But my doctor called in a prescription. Now, this is what's really funny. She called in a prescription of vitamin D2, 1.25 milligrams, 50,000 units. So, got the bottle here. And I take 1 a week, 1 pill a week. So there's 12 pills in the bottle. It cost me $28. I don't know if my insurance covered any of it, or if they just don't cover this because it's a vitamin. But they look like this. And don't these look like Advil gel caps to you? Don't they? Because that's what it looks like to me. It looks like a Advil gel cap. So I take 1 a week for the next 12 weeks, and then I get my refill. So she wants me to take, my doctor, 1 a week of these, and then these every day to get my D up. Now this is D3, and this is D2. So that's what I'm going through right now. Like that's, and I mean, when you look at the big picture, that's not awful, but your D vitamins has a lot to do with your teeth and your mouth, teeth health and all that stuff. So I'm doing what I can. I can say that I can feel changes like in my bones and stuff. Not for the good, but for the worse. And I told my dentist, I said I have osteoporosis, and she said, I'm not surprised, like you're skinny as a rail. Anyway, throwing this in as the last part of the topic. Let's see, Saturday we did the overhaul in our eating habits. Saturday, Sunday, Monday, Tuesday. Today's day 4. No sugar, no salt. I gave up my morning tea because I put sugar in my morning tea. So I gave up my morning tea because I can't drink it without sugar. And it's my water, and I have my afternoon coffee because this is the only guilty pleasure I give myself now. On Saturday morning when I got on the scale, I weighed 109.6, and then the day after I was at 109.0, and this morning and yesterday morning I weighed in at 107.4. I lose weight pretty quickly, and I'm not eating anything between meals at all. Like, I'm not snacking at all. And I know that I have to be very careful with my food and when I eat and how I eat, because I do lose weight very quickly. For me, my comfort level weight is about 102 because I'm very tiny. I'm 5'1" in a little bit because of the osteoporosis. But I've always been tiny, and that's just how I am. So eating, junk food and having chips and having chocolate and all that, some pounds came on me, and they go right around your middle, which is not a good kind of fat to have, I guess. I don't know. Anyway, so I'm finding like my perfect with my food, mandarin oranges, and I picked up rye bread today because I do like rye bread, put a little bit of peanut butter on it. And so I got 2 bags of mandarin oranges, and I got a container of strawberries, and I got more cottage cheese because there's protein in cottage cheese. Anyway, doing my best. So if you haven't had your D vitamin checked, maybe you should. I don't know. My last doctor that I had forever and ever, vitamin levels were never checked. And I go to my doctor again in February, and she's going to we're doing another blood test a week prior, and she's going to check my cholesterol again. And I can bet you that my cholesterol level, which is a little bit on the high side now, is going to be down in the normal range. Between me walking the treadmill and changing up my eating habits and increasing my water, it's going to be down to a more comfortable range. So that's what's happening right this minute. But I am so thrilled. It's 13 minutes, 14 minutes. I am so thrilled to have gotten through the dentist. When you have anxiety and you have panic attacks and you haven't been to the dentist in 3 years, like going to the dentist after 6 months is crazy enough. After 3 years, I'm so proud of myself for my dental care. I'm so proud of myself, and I'm not ashamed to say that. So that's what's going on right now with me. Thanks for being with me, for the people who are with me and stick around and watch the videos. Not that many people watch the videos, and I totally get it. I'm not everybody's cup of tea. Content isn't that exciting, but I'm here nonetheless, just for the family that stays with me. I appreciate you guys so much. So I'm going to go. I went over by 5 minutes, and I know I shouldn't keep timing, but it's probably better to keep things shorter. So I'm going to go. Please take care of yourselves, and I'll talk to you soon.